welcome the arrival of Sinovac.
Dumami pa ang mga Pilipinong gustong magpabakuna.
Barangada ng COVID vaccination.
Yung food court na ito, open na rin bukas.
The whole community will be there.
Na nakatulong sa pagbaba ng mga kaso, ito ang bakuna.
The Philippine College of Physicians invites you to its 25th Mid-Year Convention, hosted by the Central Luzon chapter. In this era of integrating virtual and face-to-face methods, learn on how we can move forward without compromising our practice of medicine. Join us in the 25th Mid-Year Face-to-Face with limited Zoom link convention. Let us learn more practical approaches to relevant and diverse issues in internal medicine with a renewed perspective. Interesting topics await you. On November 18 to 19, 2022. Save the date. See you at the premier convention facility in Central Luzon, Subic Bay Freeport Zone at the Subic Bay Exhibition and Convention Center. Don't be left out. Register now. See you there.
President Rodrigo Duterte welcomed the arrival of Sinovac.
Dumami pa ang mga Pilipinong gustong magpabakuna.
Barangada ng COVID vaccination.
Yung food court na ito, open na rin bukas.
The whole community will be there.
Na nakatulong sa pagbaba ng mga kaso, ito ang bakuna.
The Philippine College of Physicians invites you to its 25th Mid-Year Convention, hosted by the Central Luzon chapter. In this era of integrating virtual and face-to-face methods, learn on how we can move forward without compromising our practice of medicine. Join us in the 25th Mid-Year Face-to-Face with limited Zoom link convention. Let us learn more practical approaches to relevant and diverse issues in internal medicine with a renewed perspective. Interesting topics await you. On November 18 to 19, 2022. Save the date. See you at the premier convention facility in Central Luzon, Subic Bay Freeport Zone at the Subic Bay Exhibition and Convention Center. Don't be left out. Register now. See you there.
President Rodrigo Duterte welcomed the arrival of Sinovac.
Dumami pa ang mga Pilipinong gustong magpabakuna.
Barangada ng COVID vaccination.
Yung food court na ito, open na rin bukas.
The whole community will be there.
Na nakatulong sa pagbaba ng mga kaso, ito ang bakuna.
The Philippine College of Physicians invites you to its 25th Mid-Year Convention, hosted by the Central Luzon chapter. In this era of integrating virtual and face-to-face methods, learn on how we can move forward without compromising our practice of medicine. Join us in the 25th Mid-Year Face-to-Face with limited Zoom link convention. Let us learn more practical approaches to relevant and diverse issues in internal medicine with a renewed perspective. Interesting topics await you. On November 18 to 19, 2022. Save the date. See you at the premier convention facility in Central Luzon, Subic Bay Freeport Zone at the Subic Bay Exhibition and Convention Center. Don't be left out. Register now. See you there.
welcome the arrival of Sinovac.
Dumami pa ang mga Pilipinong gustong magpabakuna.
Barangada ng COVID vaccination.
Yung food court na ito, open na rin bukas.
The whole community will be there.
na nakatulong sa pagbaba ng mga kaso, ito ang bakuna.
The Philippine College of Physicians invites you to its 25th Mid-Year Convention, hosted by the Central Luzon chapter. In this era of integrating virtual and face-to-face methods, learn on how we can move forward without compromising our practice of medicine. Join us in the 25th Mid-Year Face-to-Face with limited Zoom link convention. Let us learn more practical approaches to relevant and diverse issues in internal medicine with a renewed perspective. Interesting topics await you. On November 18 to 19, 2022. Save the date. See you at the premier convention facility in Central Luzon, Subic Bay Freeport Zone at the Subic Bay Exhibition and Convention Center. Don't be left out. Register now. See you there.
President Rodrigo Duterte welcomed the arrival of Sinovac.
Dumami pa ang mga Pilipinong gustong magpabakuna.
Barangada ng COVID vaccination.
Yung food court na ito, open na rin bukas.
The whole community will be there.
na nakatulong sa pagbaba ng mga kaso, ito ang bakuna.
The Philippine College of Physicians invites you to its 25th Mid-Year Convention, hosted by the Central Luzon chapter. In this era of integrating virtual and face-to-face methods, learn on how we can move forward without compromising our practice of medicine. Join us in the 25th Mid-Year Face-to-Face with limited Zoom link convention. Let us learn more practical approaches to relevant and diverse issues in internal medicine with a renewed perspective. Interesting topics await you. On November 18 to 19, 2022. Save the date. See you at the premier convention facility in Central Luzon, Subic Bay Freeport Zone at the Subic Bay Exhibition and Convention Center. Don't be left out. Register now. See you there.
President Rodrigo Duterte welcomed the arrival of Sinovac.
Dumami pa ang mga Pilipinong gustong magpabakuna.
Barangada ng COVID vaccination.
Yung food court na ito, open na rin bukas.
The whole community will be there.
na nakatulong sa pagbaba ng mga kaso, ito ang bakuna.
The Philippine College of Physicians invites you to its 25th Mid-Year Convention, hosted by the Central Luzon chapter. In this era of integrating virtual and face-to-face methods, learn on how we can move forward without compromising our practice of medicine. Join us in the 25th Mid-Year Face-to-Face with limited Zoom link convention. Let us learn more practical approaches to relevant and diverse issues in internal medicine with a renewed perspective. Interesting topics await you. On November 18 to 19, 2022. Save the date. See you at the premier convention facility in Central Luzon, Subic Bay, Freeport Zone at the Subic Bay Exhibition and Convention Center. Don't be left out. Register now. See you there.
President Rodrigo Duterte welcomed the arrival of Sinovac.
Dumami pa ang mga Pilipinong gustong magpabakuna.
Barangada ng COVID vaccinations.
Yung food court na ito, open na rin bukas.
The whole community will be there.
Na nakatulong sa pagbaba ng mga kaso, ito ang bakuna.
The Philippine College of Physicians invites you to its 25th Mid-Year Convention, hosted by the Central Luzon chapter. In this era of integrating virtual and face-to-face methods, learn on how we can move forward without compromising our practice of medicine. Join us in the 25th Mid-Year Face-to-Face with limited Zoom link convention. Let us learn more practical approaches to relevant and diverse issues in internal medicine with a renewed perspective. Interesting topics await you. On November 18 to 19, 2022. Save the date. See you at the premier convention facility in Central Luzon. Subic Bay, Freeport Zone at the Subic Bay Exhibition and Convention Center. Don't be left out. Register now. See you there.
Let us put ourselves in the holy presence of our Lord. Our dearest Heavenly Father, thank you for making all things possible. We are grateful for all the blessings you are pouring upon each one of us, despite the challenges we are all currently facing. Thank you for blessing us today with the wonderful opportunity to meet virtually and learn together in the awesomely exciting webinar. May your blessings of wisdom and guidance be upon us, all through the sharing and impartation of knowledge and skills by our resource speakers, facilitators, and moderators. May all of us learn together, upgrade our competencies, and capacitate us to be the help in the development of our learners' lives and communities in the spirit of your love and generosity. May we now humbly commit every part of this webinar to you as we all bring you the glory, honor, and praises for your kingdom and holy name's sake. All this we pray in the precious name of our Lord and Savior Jesus Christ. Amen.
Through the dreadful darkness, we shall lead the light and lead a path to wisdom. Our will to be our lives. To those in pain and suffering, we shall hear a call. With us to care and comfort from that above all.
the Philippine College of Physicians, through the Committee on Media Communication and Health Forum, presents its bi-monthly lay forum to promote the advocacies and mission of the college and its component and affiliate societies. An avenue of accurate and up-to-date conversations with the media and the general public, with timely and diverse topics covering vital public health and medical information, straight from the experts. In a platform that is convenient, accessible, and highly engaging. Welcome to the PCP Health Forum.
My fellow members of the Philippine College of Physicians, my fellow health workers, to our ever supportive media partners, and to all the guests and viewers attending in this week's Philippine College of Physicians Health Forum, the state of the PTB in the nation. Welcome and thank you for attending. I am Dr. Ana Katrina Tujino, a fellow of the PCP and a fellow of the PCCP and a member of the Media Communications Committee, and I will be the moderator for today's health forum. As we are also celebrating the month of August, which is the National Lung Month, and just last August 19, we also celebrated the National TB Day. The subject for today's health forum is very fitting to be discussed. Okay, so according to the World Health Organization, TB or tuberculosis is the second leading infectious killer and is only second to COVID-19 infection. It is also the third leading cause of death worldwide. In 2020, 10 million people were infected with TB worldwide. In the same year, the Philippines was included in the top 30 high TB burden countries, wherein 86% of the new TB cases were accounted from these countries. And the Philippines also ranked fourth in the top 8 countries that accounted for 2/3 of the total cases. So as we can see, TB continues to be a burden to not just us Filipinos, but all over the world. So to formally welcome us in today's health forum, I would like to introduce to you the incumbent member of the PCP Board of Regents, Dr. Ophelia Samarsi, to give us her welcoming message.
Good morning, everyone. To all our media guests, FB Live listeners, and YouTube watchers who are attending and watching this webinar on Facebook Live and on YouTube, good morning to all of them as well. First and foremost, on behalf of the Philippine College of Physicians Board of Regents, I welcome all of you to the latest of the series of PCP's Health Forum through the Committee of Media and Health Forum, promoting advocacies and also vision which aims to convey accurate and up-to-date information on the most pertinent and burning issues at hand through this digital communications platform. So with all of you, with the media and the public. And through this endeavor, we have been bringing you with timely and diverse topics covering vital public health and medical informations, straight from the experts through this platform that is convenient, accessible, and highly engaging. Since 2020, we have faced the full wrath of COVID-19, which tested all of us, our resilience. So for the first time ever since martial law years, lockdowns had to be imposed to prevent the COVID virus from further ravaging our citizenry. Hence, there is a need for all of us to future-proof ourselves in view of the dark days ahead and be more informed as the threat of COVID-19 continues to lurk while monkeypox looms and stagnant economy hovering in the distance. So today, we will be enlightened by our speaker, a PCP luminary and PCP Board Secretary, Dr. Imelda M. Mateo, to be moderated by our very own Dr. Ana Katrina Tuhino, with the topic State of the PTB in the Nation. So, as has been already discussed by Ana, tuberculosis has been a major cause of illness and death in the Philippines. Yet, TB control efforts have historically been fragmented and uncoordinated and recently disrupted by the pandemic. So while there has been significant advances in improving the quality and the extent of TB control efforts, but the private sector and even some of the other departments aside from DOH have not been integrated into the overall TB control activities. So recognizing the need for a more informed public towards a more unified and concerted efforts controlling one of the oldest infections, which is supposed to be treatable infectious menace, yet TB is one of the most stubborn and obstinate to be cured. So while it may not seem as deadly or as fast spreader as COVID-19, and yet TB has caused global threat as significant as any deadly pandemic. In fact, TB is a leading infectious disease killer in the world, claiming 1.5 million lives each year. And worse, just like the COVID virus, TB has been also transforming itself to be a formidable foe, resisting standard treatments for decades already. And in fact, in 1993, the WHO issued a press con announcing that TB was a global emergency at the time, making it the first infectious disease to be declared as such months ahead of COVID. Hence, with global focus in fighting this unpredictable fight with the novel coronavirus, the used to be biggest chronic infectious killer, TB, was hugely affected from the shift in attention due to the certain similarities in the behavior of the two infectious agents. There have been inevitable consequences. On one hand, administrative measures to contain SARS-CoV-2 have simultaneously led to a breaking in the chain of TB management, and consequently, a regression and retreat occurred in the milestones achieved in the battle against TB. On the other hand, the same measures and heightened hygiene awareness had helped to decrease the spread of the TB bacilli. So, with an improved understanding of the interrelationships and the outcomes noticed in 2020, we can now better gear ourselves to develop a more sophisticated and robust strategy to actually tilt the balance against TB. So keeping this in mind, this webinar is even more relevant than ever and also exciting. So please join us as our speaker discusses in detail the status and implications of TB as an unwavering health hazard during this COVID-19 pandemic. Hence, more than any time, it is crucial for all of us to understand TB as it has posed huge challenge among internists, pulmonologists, infectious disease specialists, the government, and various stakeholders in the Philippines. So I want you to sit back and relax. Please stay tuned and continue to watch until the end of the discussion. And once again, welcome to the PCP Health Forum and be enlightened. Because as in Shakespeare's Hamlet, the biggest question is to be or not to be, or to live or not to live. But today, let it be said, remember TB and nothing but TB, lest we forget. So, COVID-19, monkeypox, or Ebola would probably be not the last of future pandemics that would threaten mankind, and there's the potential to wipe out our existence from this world. Yet, more likely, this may not be here to stay long. And yet, TB is here, has been here, and has stayed long enough, much longer than our own lifespans, and will surely stay even longer. So let's try to beat TB by watching this webinar. Stay tuned and keep safe. Maraming salamat po.
Okay. Thank you, Dr. C, for your
Recording in
message.
progress.
Okay. Thank you, Dr. C, for your message and why we must talk about TB and why TB is a relevant issue today and why we must shine awareness on this condition. So before we start the lecture proper, we would like to remind our attendees and participants that you can type or write your questions in the chat box in the Zoom webinar or through the chat box in the FB Live so that we can answer the questions later in the Q&A portion. So as we stated nga, the tuberculosis is a disease that is caused by Mycobacterium tuberculosis and most commonly affects the lungs. And it is spread through air from one person to another, either through coughing, sneezing, spitting, or even singing. And symptoms of active TB include cough, fever, night sweats, or weight loss, which may occur from weeks to months. Tuberculosis, again, what Dr. Rassi says, it's a preventable and curable condition. But however, due to the COVID-19 pandemic and threat, the number of TB cases identified decreased due to the disruption of the active TB case findings and limited services. Hence, to move us back on track, the goal is to reverse the impact that the COVID-19 pandemic had and to prioritize and restore our access to our TB case identification, management, and treatment. So to further enlighten us on what the state of TB is in the nation today, I would like to welcome our distinguished speaker for today's Health Forum. She is the incumbent secretary of the PCP Board of Regents, and she is also the president of the Philippine College of Chest Physicians. She's also the medical center chief 2 of DOH Amang Rodriguez Memorial Medical Center, the secretary of the Association of Hospital Administrators in Government Service, and the vice president of the Action on Smoking and Health. She's also the awardee for the government service category Dr. Jose P. Rizal Memorial Awards 2021 and a government service awardee of the Memorial Medical Center Inc. and College of Medicine Alumni Association in the 2020. She's also dangal ng Paaralan Elementarya ng Santo Niño Antas ng Medicina Award in 2016, and in 2012 she was the Distinguished Fellow Award of the Philippine College of Physicians, and she received the Presidential Award in the Philippine College of Chest Physicians in 2012. It is my honor and privilege to introduce to you to our speaker today, Dr. Imelda M. Mateo.
Good morning. Magandang umaga po sa ating lahat. Sana'y lahat tayo ay nasa ligtas na kalagayan. At of course, we want to welcome all our members of the Philippine College of Physicians, our fellows, our diplomates, trainees, our media partners, at ating pong mga kababayan in tune with us through Facebook or YouTube. So I'd like to start. Thank you very much, Dr. C. Often for the introduction and giving prelude to my lecture about tuberculosis in the Philippines. So if I may, I'd like to start by, okay, so am I already with access to sharing? Okay, so some declarations. I'm presently the secretary of the PCP and the president of Philippine College of Chest Physicians. Before I proceed, I would like to give due credit to the chair of the Council of Tuberculosis of PCCP, Dr. Elizabeth Dags Cadena, for sharing with me the statistics on tuberculosis in the Philippines. Okay, so right. I would like to get, do I have the control? All right. So just to give you a situationer. So Do I have the control here now? All right, let's go back. Okay. Okay. So we would like to let you know that during the pandemic, there is the immediate obvious impact of COVID-related disruptions, no? Disruptions, okay? There's a big global drop in number of people newly diagnosed with TB and reported. So if you look at the statistics, in 2019, there were 7.1 million reported to have tuberculosis, no, globally. But there is a sudden drop from 7.1 to 5.8 million in 2020. This is the time when the onset of the pandemic, okay, and we have more concerns and pressing problems due to COVID and the pandemic and the lockdown. So there was an 18% drop of the notified or reported number of TB cases. No? So this is according to the 2021 Global Tuberculosis Report. Okay, so now let's go and focus on our own statistics. No? The Philippine National Tuberculosis Report in 2021 show that while in 2019 there was already an estimated almost 600,000 people falling ill with tuberculosis in the Philippines, and only 62% of them were male. That's 373,000, and 26% are women, and 12% are children. So there's an estimated 27,000, ranging from 23 to 31,000 people dying from TB in 2019. And between 2015 and 2019, the TB mortality in the Philippines has been reduced in average to 2.8 annually. So that was quite a progress already till 2019. Until in 2020, there were 257,000 new and relapsed TB cases detected by our health systems in the Philippines, which reflected a gap of 57% between the estimated and notified case. So if you look at the 2019 estimated cases, which is almost 600,000, to reported 340 to 257 reported. So you see, we are missing this 57%. No? So this is because there were disruptions in the services in 2020 to TB-related services due to the COVID-19 epidemic. And these reversed the gains of the decades. While we were moving forward already, it put a hold to this because of the pandemic. And in 2020, about 152,000 fewer people with TB were detected by health systems in the Philippines, comparing to the 2019 statistics or numbers. So what then will be the strategy of the government? So there were already, and this is already in place, no? The strategic interventions to fill that gap of unreported, undiagnosed, and untreated TB cases. So we came up with the intensified case finding, or the ICF, which is a systematic screening in health facilities by offering symptom screening. So those patients with a cough, or especially cough of more than 2 weeks, and attributed to any other illness, and an increase in high-risk screening and chest X-ray screening among all adults who consulted. So in fact, there were interventions and there were policies that would impose annual screening through chest X-ray of facilities, of organizations and companies. No, it is mandated that there should be annual screening using chest X-ray, even for asymptomatic patients. And number 2 of the strategic interventions is also the active case finding, or the ACF. What is this? This is a systematic screening in high-risk communities. For example, the urban and the rural poor, where we know there are congregations or it's not enough ventilation and spaces. No, they're in aggregates. They work in limited spaces, confined to limited areas of home, communities, and workplaces. And an classic example of this are the jails and the prisons. We use symptom screening. That is, of course, the cough of at least more than 2 weeks duration, unexplained by other illnesses, and doing chest X-ray through mobile screening followed by rapid molecular testing or the gene expert as well. No? We also went to enhanced case finding or the ECF, which is this time community-based. There will be symptom screening of all the families, of all the residents in the community, and provision of sputum collection and transport services. For example, we have the specimen transport riders, or we call it the striders, no? STR riders, no? And we do contact investigation. For those patients who have been diagnosed to have TB, we look at their family, their co-workers, especially those in close contact with them. And we also do the integrated contact investigation or the LTBI or the latent TB investigation or infection case finding. So this is part of our intensive case finding. Latent meaning the patient already has the TB infection but is still asymptomatic, and we want to catch them in the early stage of TB disease or TB infection. So once again, we have the ICF, intensive case finding, the active case finding, we'll go to the communities, and the enhanced case finding. Okay, so what do we do with this? If we have this, we do, of course, testing. We intensified too the testing and diagnosis. This is in compliance with the mandatory notification law. That means for those who are diagnosed to have TB, it is the responsibility of the attending healthcare worker to report this TB case. Okay, so we have that, the National Registry. We have the proper venue and the offices to report these cases too. We also do a rapid diagnostic test, and we do this in the expanded phase, and we want them utilized or maximized, utilized maximally. No? So what are these rapid diagnostic tests? We have the gene expert. No? It's also the PCR testing. It's not only during COVID that we have the PCR. PCR testing care of the gene expert. No? We've had that in place for almost 2 decades, more than 2 decades already. And these are the newer ones, the line probe assay, the drug susceptibility testing, and of course, improvement of the quality of clinical diagnosis. That means there is a great responsibility for the attending physician or the healthcare worker who are in the first line of encounter with the TB patients, no? To make sure that the clinical diagnosis is done properly, correctly, and in the standards that have been recommended. Okay? So let's look at this graph. I'll walk you through this. So this is the data source, which is from the global TB database. No? So this is the source is from the World Population Prospects in 2019. So we have the bacteriologically confirmed TB, the red one. No? Ano ba yung bacteriologically confirmed? These are those that have been proven to be positive with sputum, direct sputum smear microscopy, or even with culture. Okay, so they have been diagnosed bacteriologically, so that means it has been documented that TB organism is really in place or has been detected, or the clinically diagnosed, which means with symptoms upon consult, with the four classic signs of TB, no? The cough of more than 2 weeks, night sweats, fever, okay, and chills. Those are the classic. But it's not always that you have the 4. But if you have a high index of suspicion clinically, then you can declare these patients to be presumptive TB. And if it's confirmed by chest x-ray, that's one way of also clinically diagnosing TB. Now, it has to be supported with that, plus the clinical presentation. And we also have the extrapulmonary TB, right? This is the brown line, which is 32%. Okay, so this comprises the TB cases here, no? Globally, okay? And there is an annual percent of change between 2019 and 2020. Look at that. You see the drop, whether it's bacteriologically confirmed, clinically diagnosed, or even the diagnosed extrapulmonary TB, you would see the decline. No? So that's the less 32% for extrapulmonary, less than 40 or lower than 46% decline from 2019 to 2020. And that's the impact of COVID and the pandemic and the lockdown on TB diagnosis globally. All right, so let's look here. This is the number of rifampicin-resistant TB and detected, and those fluoroquinolone resistant and fluoroquinolone drug sensitivity susceptibility testing coverage from 2017 to 2019. So you'd see here, there's already an increase in the diagnosis, in the detection, okay? But from 20 and the decline, and where this is one of our wins already, no? There's already a decline in the resistance rate, okay? Look at that. I'm sorry, that's tested for fluoroquinolone, no? So that's the average, okay? The testing coverage has declined from 2018 to 2019 to 2020. In other words, our wins have been affected because of the pandemic. So what about the treatment, the strategic interventions that we have achieved and then have been affected by the pandemic? So we have established the healthcare provider networks, now offering full TB care as a continuum. Now, this is from the frontliners or the triage officers, from the primary care workers in the rural health centers or in the clinics. And then we refer them to the DOTS facilities, the directly observed treatment strategy clinics, because this is where they can avail of the free and full treatment or the meds for TB, no? And of course, we also had the adoption of patient-centered care. While in the past decade, we are very strict in mandating that you have to consult us every week. You have to report to us every week, and then every month thereafter, after 2 months. This time, we want to make sure that the patient is involved in their own care of TB. We have to adjust to the lifestyle, to the work time, no? To the accessibility or the distance of the patient to the facility where they can be monitored or given treatment or drugs. No? So we want them to have an active part or active role in the management of their own TB, and we can be flexible without compromising the completeness or the full treatment of the patient, especially for the short course chemotherapy, which is 6 months. No? We also strengthen the active drug safety monitoring and management. This means that we have to be constantly in communication with the patient. We give them an open line of communication through text messages, now through, I guess, Viber and Messenger. We want to be in touch. Now, the primary care provider, the healthcare provider, whether a physician or a nurse in the DOTS facility, should always keep in touch with them and ensuring that they are not lost to follow up. Because this is one way of us being assured too that the patient will be able to take the medication daily and compliance is good and they will complete the treatment, because that is one of the major factor why we develop resistant TB. If the treatment is interrupted, if the patient is lost to follow up. And of course, the strengthening of TB and HIV collaboration. It's already mandatory that for patients or the PLHIV or people living with HIV, that there is screening and advice, no, and counseling for TB too. No? In the same way that for patients with TB are also, especially with patients who have risk factors and who have lifestyle behavior that may pertain to HIV predisposition, and they are diagnosed to have TB, they have to go through the counseling and ensure that TB and HIV is really intensified. Screening is also intensified. Okay. So this is just the National TB Program Annual Report in the Philippines in 2021. You'd see here the light in the legend that the light pink bar are those who were successfully treated, and the dark red are those who died, and the black line are those who failed treatment, and the lighter pink, or I think orange, no, these are the patients who have been lost to follow up. So if you look at where we were in 2019, the target of 90% has almost been achieved, okay, in a majority of the regions. Now look at that, okay? And we were almost going to that place already until beyond 2019, the loss to follow up and those have been increasing again. Now look at that. So medyo tumataas na ulit. This is because we have lost the constant follow-up and tutok to our patients with tuberculosis during the pandemic. Okay. So how do then we prevent? The strategic interventions in place till 2019, in fact, even at the moment still, is we want to adopt the short tuberculosis preventive treatment, the TPT. There are already, especially for the drug-resistant MDR, multi-drug resistant MDR TB, we want to shorten it. Whereas before it's from 18 months to 2 years. Now we want to shorten it further so that compliance will be higher or greater, and adherence to treatment will be more likely for patients undergoing the prolonged treatment. And of course, the implementation of the infection prevention control should be practiced. We have proven this. This was kind of put in the sidelight before COVID pandemic, right? Now we are so cautious and conscious of this, and this really has to be in place. While the program has already been in place for several decades, it is only now that we see the impact and the outcome if we do not implement the infection prevention and control. Okay, so what are then our latest accomplishments from 2021 to till June 2020? Let's look. Okay, so these are the TB indicators. These are the outcome indicators that we look at. We check for the presumptive TB tested with bacteriologic test. Bacteriologic test meaning direct sputum smear microscopy has been done, or even TB culture has been done as well, because we want to see the presence of the bacteria or the tuberculosis bacteria. And we also, outcome indicator will also include number of TB cases notified, whether they're new and they're relapsed. So we want to look at how much have been reported. Okay. And we want to look at the drug-resistant TB cases, which has been reported or notified. And the drug susceptibility of TB treatment success, whether this is for new cases or the retreatment or the relapse, and drug-resistant TB treatment success rate, we want to look at that as well, and the number of given TB preventive treatment. Okay, so these are the targets for 2022. Okay, how far are we now? Look at that. These are our accomplishments. For 2021, there's really a decline. But how do we reach this if in 2021 we have not been delivering much? It's almost like 700,000 only. Or even the reporting of the TB cases is, well, we have reported, and the target by 2022, look at that. Have we reached it? If you add it in with the 2021, our target, plus the 2020, we're almost nearing the 493. But we want to ensure that in 2022, we will achieve the 493 because it's half of the year and we can still catch up. It's almost half of 493. And the number of drug-resistant TB cases notified, this a dismal 2,956 for 2022. Even if you double that till December, it's only 5,900 plus. It's still 50% of our target for 2022. I'm not sure if we add this 2021, will it result to this 11,700? But we're talking of annual 2022 target. Okay, and for the drug susceptible TB treatment success rate, we want to reach 90%. Okay, and in 2021, we achieved 76% only. For 2022, well, I'd like to be optimistic, 78 as of June. We still have 6 months to rally. We hope we can meet the 90% target, so that's only 12% to run after to make it 90%. And for the drug-resistant TB treatment success rate, we're aiming for 85%. We're how many? We're 7% short I think we can still do that, no, with best efforts and motivation, and double all our efforts. Okay. And what about the outcome indicator as far as the number of given TB preventive treatment? Which we're lagging behind. It's less than 10% of our target, which is 197,000, or only 11,000. Preventive treatment, I guess this is the latent TB treatment, and even not only the drugs, no, interventions, TB interventions, TB, which includes nourishment or nutrition and healthy lifestyle. So I guess we're lagging, no? We're only 10% of our target. Okay, so look at this, no? The number of given TB preventive treatment, okay, which are household contacts. TB preventive treatment usually, of course, is shorter than the six months of intensive and the maintenance phase, no? So we see here that the household contacts 5 years and above, of those household contacts under 5 years, of course, we give more for the children for the preventive treatment, because for adults, which is more than 5 years old, usually they can, when they present, it's not only latent TB, but we have to treat them intensively or complete the short course chemotherapy of 6 months. Okay, so you see here in 2020, we are increasing already the household contacts above 5 years old. There's already increasing trend, no, of the household contact. Look at. But if you notice, versus 2019 and earlier, there's already an increase in household contact for 5 years and above. Okay, so this is just I think this is my ending slide, because we want to give more for the question and answer portion. So I'd like to quote Dr. Giorgio Franuti, which says that, who stated that the biggest monster is spreading, and it's not the coronavirus, because tuberculosis kills 1.5 million people each year, and the lockdowns and supply chain disruptions threaten progress against the disease, including HIV and malaria. So thank you very much. I hope I have presented to you the state of the nation of the TB in the Philippines, and I would welcome questions and clarifications in the question and answer portion. Thank you. Let's all stay safe. I hope I have enlightened you enough. Kat?
Hi. Hi,
Okay.
Doc. Thank you. Thank you again, Dr. Mateo, for yung very informative discussion on what the state of PTB is in our country. For those who have questions, you may type on our chat box again, and in the FB Live chat box, so that we can answer them. But Doctoria, we have already questions from the webinar. Let's start, Doctor, if you're ready po for the Q&A.
Yeah.
Okay, we have one from one of our attendees in the Zoom. Good AM. Thank you for the very informative lecture. We have a case scenario, Doc. The patient presented with cough for more than 2 weeks, with associated fever, weight loss, and X-ray showed PTB. Gene expert done and showed negative results for TB. Should we still treat the patient for TB? Please advise. Thank you.
Yes, definitely. If you saw the classification of TB, active TB, or diagnosed TB, we have the bacteriologically confirmed, clinically diagnosed, and even the X formula. This patient will fall under the clinically diagnosed TB, especially if by history patient has exposure to someone with TB, or the patient is immunocompromised. Of course, we would treat that. Now, this is a classic example of a clinically diagnosed TB patient. Yes, definitely, let's treat this. And we treat with the same regimen, okay? If this is the newly diagnosed, clinically diagnosed TB, we let them be treated for the 6-month short course chemotherapy, 2 months intensive, and 4 months the maintenance phase.
Okay.
Ayun.
Thank you, Dr. For distinguishing to us what is bacteriologically diagnosed TB versus clinically diagnosed TB, and both should be treated for 6 months na TB treatment. Yes. So another question is from the audience, Dr. Is the stigma of having TB still exist, and has this improved with social media education and awareness?
I guess it has improved a lot now. Considering like 15 years back, I had a patient diagnosed to have TB with cavitation, and the husband would say a policeman at that. No? I'd rather have my wife have cancer than TB. Isn't that devastating and so sad? No, we don't encounter those comments anymore. Yes, because we know with the intensive media mileage and promotion and the program of DOH as well in our TB program, that TB is treatable. In fact, even if you are diagnosed to be TB and if you have taken 2 weeks straight, of course, that is if your sputum is negative already. You are not communicable anymore. You should not be isolated anymore. Na hindi katulad before na ina-isolate, pinagtatago, binabanlian yung mga ginagamit na kutsara at tinidor, di ba? Remember that in the olden decades, no? But not anymore. No? The key here is still protect yourself. No, if you haven't started treatment yet and you are sputum positive, make sure you wear your mask. No, alam nyo, the masking is not only due to COVID. No, it has been there in place. In fact, we even recommend that for viral infection. No? So yes, the stigma has lessened, but those who have not been properly oriented and educated would still feel so bad and would still feel they are parang sinintensyahan na sila, no, when they have TB. But that's not the case because TB is treatable. You just have to be diagnosed properly, consult, and given treatment. And the key is complete your treatment. You have to have good compliance.
Yes, Doctor, I agree on that, all of that. We have another question from the webinar, Doctora. So he or she says, thank you so much for the very informative lecture. Do you need to treat a 92-year-old asymptomatic patient, but with X-ray findings of TB?
Okay, first is elderly, so immunocompromised. Okay, number 2 is asymptomatic, but with chest X-ray finding of TB. Now, you go back to the history. Was there a treatment of TB in the past? Was there history of TB infection or disease? Because this TB, if you have to examine more, is this fibrotic? Are these scars? Are these the remnants of a previous TB disease? So that's very important. Those that are the information that you have to find out. And the patient has exposure with somebody who has TB. Okay, is a patient, other than being elderly, have diabetes or other immunocompromising illness? Asymptomatic, okay. This is kind of tricky because asymptomatic, but there's X-ray finding. If this is, and make sure that you have a comparative film. No? If the patient has available film of chest X-ray done a year or 2 years back, and it is normal in the past, then this might be a new TB illness or disease, infection. And even if the patient is asymptomatic, I'm not sure if the patient asymptomatic being no cough, but take note of weight loss, no, if there are other signs, no telltale signs. And the patient has no, I would treat if this is a new infection or if this is a new disease. So I would just make sure that the patient is monitored and would have baseline liver function, baseline kidney function. And of course, most probably better than pati ophthalmologic consult for baseline eye function. But so the key is get a good history, get a history of previous TB infection, because this might just be a scar. And we want to be cautious as well. No? There's the interstitial lung disease that can be diagnosed by radiograph as also TB lesions. No? Would we go for high resolution CT scan? We'll see. Would a CT scan determine or detect a soft lesions that would allude to an active TB infection? So this might be done if it is accessible and if all the other interventions have been done already. I hope that would give the person enlightenment, whoever asked this. Okay.
Okay, Dr. So key is a detailed history and yun nga, a
Yes,
comparison of a previous X-ray rin, Dr. So I hope this answers your question, the anonymous person in the webinar po. So we have pouring questions, Dr.
Yeah,
so
I know.
I can see
I can see.
yes. From Dr. Lim, can clinically diagnosed TB still avail anti-TB medicines from DOTS facilities or clinic? Thank you.
Yes, they can. If I may, the DOH hospitals, even the health centers, have available, supposed to be. So because of the program of PH, would have available anti-TB drugs. No, they might be required still to have a sputum collection if non-productive cough through sputum induction. And if it turns out negative, they can still be treated because this Dr. Lim, this is patient will fall into the category of the clinically diagnosed TB. Okay, you might have to explain to your patients that the DOTS clinic might still require screening, which is DSSM, direct sputum smear microscopy, that they would know that if the patient has a non-productive cough, there really has no cough, there is no way they can retrieve specimen for DSSM. And yes, they will fall under category of the clinically diagnosed TB.
Okay. Another question from the webinar, Doc. There was we have a case again. Ang daming cases actually. I think I'll check if they have similar cases in the chat box. So a young asymptomatic immunocompetent patient but with close contact or exposure with a confirmed TB patient. Gene expert is negative, chest x-ray is equivocal, so not much yung nakita sa x-ray. But there is a small apical infiltrate in the x-ray but wasn't convinced. I didn't treat for now. Can I just follow up with x-ray 3 to 4 months after? Young asymptomatic doc.
That's a good yeah, that's a good process. That's a good step to do. But I would want you to also refer to a previous chest x-ray for comparison that patient might have, unless this is first chest x-ray now. I would maybe clinically, yes, you can do a repeat chest x-ray after 3 months, but if you can clinically or follow up after a month or advise the patient that for any respiratory tract symptoms, especially for TB of 2 weeks, consult kagad sa'yo yung patient. So, number 2, there are 2 ways. Of course, you go ahead with this, but increase your consult. No? I would feel comfortable following up the patient, even at a chest x-ray, just to monitor or make sure you don't lose the patient within that 3 months, because in 3 months, something might happen. No? If this is really TB, it can progress, and you wouldn't want to be surprised with an already full-blown TB by chest x-ray. All right. So you can get in touch with the patient naman through SMS, to just make sure you mag-check in ka lang sa akin. If you're afraid I'll charge you, just give me a short message and say, Doc, I'm okay, I have no cough. No? And please make sure this young patient is a non-smoker, because this will render him immunocompromised and more susceptible to developing TB. Okay? A full-blown TB disease.
So key, yes, Dr. Thank you. So key is close monitoring for the patient na lang.
Yes,
if you wish to not treat yung asymptomatic and yan immunocompetent patient.
Yes.
Okay. So we have another question, Doc. In terms of yung the state of TB, where are we now in terms of yung TB elimination, Dr.? Siguro a percent or cases, where are we now in our goal yung sa 2022?
Kasi we decreased, I show you the outcomes, right? So
Yes, Dr.
there are indicators. If we go back to that, there are indicators that would say we're like 10% only. Remember that last outcome factor that we want to look at, yung treatment, interventions or treatment of latent TB. There's only 10% of our target for 2022. Okay. And what about for treatment of presumptive TB? So we're not even like we're what, 10% or 11% only. We're not 50%, except for the drug susceptible treatment success rate and the treatment success rate for drug resistant TB were more than 50%. Just to review, we're 78% of our which we're just 15 or 12% short of our target, for 2020. We're doing good as far as treatment, but for reporting and notification, medyo naglag tayo, and it really suffered because of the pandemic. Okay? That's I hope I answered that query.
Thank you, Dr. In regards to that also, there's an additional question. So what do you think are the next steps of our health systems should take to improve the state of TB diagnosis, treatment, and prevention in the Philippines in this year? We have another question from our audience. Yes, Doc.
Let me get that again, Kat. What do you think?
So given all the data, Dr., that you presented regarding yung situation natin on the TB, what are the next steps of our health systems that should take to improve the state of the TB diagnosis, treatment, and prevention?
Right. Okay, we have been achieving this. We were towards that direction already in achieving our goals, in 2019. So what I can say is let's refocus and consider that it's not only COVID that there is a lot more to look at. Let's go back to our interventions, to our strategies, intensify it more. Now, make sure we are active in the reporting, in the case findings. Remember the 3 strategies that we want to achieve: the ICF, intensified case finding, active case finding, enhanced case finding, and the contact investigation. Strengthen it, because these are good tools. These are good strategies that we want to ensure implementation again. We will double up. We will make it more efficient. I know it's quite difficult to say, let's go out there now in the field, because this is where our action will be. And if we do that, we will be achieving that. If you look at the outcome factors that we are monitoring, we're almost good, even if we have this pandemic with treatment of drug susceptible and drug resistant TB. It's just the case finding and the reporting that we really are lagging, and there is much suffering that we are feeling because of the pandemic. So I guess I hope that answered the concern of the person who asked this, Kat.
Okay, Doc. So we have to really strengthen yung case finding rin, Doctor, right? So in order for us to improve rin yung the number of cases reported also, as well as treated for TB condition, for PTB. So, Doctor, we also have questions regarding employment. So I'll join it na lang yung regarding employment. So there is a patient daw, Doc, who consulted you to an incidental finding of PTB in X-ray during pre-employment requirements. Patient had no symptoms, no exposure, no previous TB treatment, hence new case. Patient has also no comorbidities. Gene expert was done and was not detected. Do we treat, or do we suggest repeat chest X-ray after a month, or follow up, or more for follow-up monitoring purpose? And then, Doctora, in regards to that, if we treat, another question in regards with employment is, do we continue this patient to go to work, yung new TB cases, even during treatment? Yes, Doctora.
All right. So all the risk factors, no exposure. Okay. All right. Young patient, asymptomatic. diagnostics by direct sputum smear microscopy or bacteriologic is negative, but there's chest X-ray finding.
Okay. Yes, doctor.
So this is not recommended because in adult you don't do skin testing. You don't do PPD. It's not even in the manual of procedure. But abroad, they would do that. No, in private clinics, they would do that. No, blindly, you can do that. But I don't recommend because it's not in the manual of procedure. So what do we do? I do a repeat X-ray maybe after 1 month, but making sure that the patient is not lost to follow up. Now, how do we convince the employer to employ this patient? Because especially abroad, no, they're so strict on this. No, in the Middle East, they do not, even if there's history of treatment already for as long as they're finding in the X-ray, even the scars, they will not hire that patient. So what do? We will not want to deprive them of the work opportunity. No? So we will have to make a communication with the employer that the risk factors and the chances of this patient, I'm sure their fear is for them to being communicable, not to spread the disease in the workplace. So to me, I would maybe ask the patient if the employer is not really keen on employing them, just wait for another month and repeat the X-ray. And if you may, some would opt to consult private clinics where they can do skin testing for adults. And there are guidelines anyway for the result of tuberculosis skin testing. But definitely in the government manual of procedure, the DOH, skin testing is not recommended for adults. It's only for children. Okay? So, anong plan? Repeat the X-ray. If there is a way that the patient is not really working in a congregate area or a crowded area, the risk of being communicable is not really there. Asymptomatic naman eh. And make sure that this patient really does not deny that there are symptoms. Baka mamaya yung mga konting cough, no? Inaano lang, no? Dinidisregard lang, dinidismiss lang na not being symptomatic. So, a good history is really very important here. No? Exposure as well and risk factors. Okay? I hope...
Okay, Ay, sige, Doktora.
I hope we answered that, Kat.
Kay Leonie Estose po. Opo. Pero Doktora, ang ano rin niya is, what if yung X-ray, meron rin pong findings, pero asymptomatic yung patient, meaning asymptomatic, walang can this patient be fit to work? And kung kunwari hindi, when will he be fit to work?
Okay.
If the patient...
So, new findings, previous X-ray wala, tapos new findings. So this is a new infection. This is a new disease. Pwedeng asymptomatic siya. Pero yung minimal weight loss kailangan delve into that. Other symptoms other than respiratory tract symptoms, no? Okay, and then there are descriptions of the X-ray that would say, well, they say yung soft infiltrates, no, hindi naman scar. Di ba, parang may air bronchogram tapos and then may soft infiltrates. Some would go as far as doing chest CT scan na mas descriptive of the infiltrates, and if it's really alluding to like an active or new lesions, I would treat. And I would treat for 6 months as well. No, I'd place it. Make sure that there is no contraindication with the drugs. Then how soon should I let this patient go back to work? After 2 weeks of treatment of the intensive phase, the patient can be given clearance to go back to work. 2 weeks of treatment in the intensive phase.
Okay, Doctor. So at least 2 weeks of treatment, then you can...
That is if the sputum is negative.
Negative, yes.
And turns out to still be negative. Okay?
Sige, Doctor. Thank you, Doc, for that clarification and as well as yung further query on pre-employment and employment cases and TB. So, let's see, Doctora. So we have ito, Doctora. I think it's relevant now that we are coming into the universal healthcare. So how will the UHC affect TB treatment, Doctora? What do you think will happen with that?
I think it will be more intensive because the frontliners and the primary care workers or physicians, the healthcare providers, will be equipped, will be trained and would have to undergo intensive training and would have to pass with a certificate that they have gone through the different programs of the Department of Health. Kasi yung early diagnosis is very vital and key. So you really have to equip and make sure that competent yung frontline healthcare workers in the first level of care. And this is where the patients would have a first contact. No? I think it will have an in place because even for the management, the government will have to ensure that treatment availability of the drugs, the supplies, no, the pills, no, the 6 months treatment will be in place. They will have to ensure that. I'm positive about this. I'm optimistic about this. It will be intensified because we will strengthen the front line and the primary care workers in the first level of care, first contact. No?
Okay, Dr. Siguro last two questions from Dr. Josephine Ramos, Doc. What are your indications for requesting for the quantiferon or yung IGRA? I think Dr. yan, no? Yung quantiferon testing.
Usually it's being given to being done for drug-resistant TB, no? We don't request that at the outset because we have the first line diagnostics, which is the direct sputum smear microscopy. Maybe for number one, relapse or retreatment, and number two, for gray, not clear-cut cases, so we can request for that. But it's not really much available. Dr. Jopay, I know you're there. I'm not very familiar in its availability yet, but some high-end centers would have that available too. If I may ask, I'm not even sure. Well, for the DOH medical centers, no, I'm not sure which ones have. I'm not too sure about its availability in lung center as well. Dr. Jop, I hope I answered your query. No? So we don't usually prescribe it or use it for new cases if the direct sputum smear microscopy is really available. So it's usually done for questionable or not clear-cut cases of TB, especially for the drug-resistant TB and for the you want to be sure for. I'm not sure if they can use it also for extrapulmonary TB. I guess they can, no? Because this is serum naman. No? Tara,
Okay.
Jopay, did I answer that?
I think she can reply, Dr. in the message chat box if you answered it. Dr. For our last question, I'm sorry if I cannot answer all the questions. Ang gaganda nga ng questions. Pero we can, I hope that you can contact us and we can give.
Yes. I'm very happy, Kat, that despite COVID, ang daming nag-i-interested, ang daming natin nakasa attention on refocusing on TB treatment, diagnosis, and reporting. I'm very happy.
So, Dr. last question about yung availability ng meds. Kasi minsan, di ba, yung availability of the meds is the problem. Is there availability also in our local health centers now with regards to yung complete TB treatment?
Okay.
6 months? Yes.
If TB DOTS is in place in the health center, it must be available. Okay. If it is not available, report this to your Center for Health Development in that region because they will ensure that it should be available because we don't want the patient to be diagnosed and treated haphazardly or incompletely because that's one mortal sin to start treatment and then not completing the 6 months treatment of the short course chemotherapy. If there are DOTS clinic without medicine, report them to DOH Center for Health Development. Okay, kailangan kasi in place yan.
Yes, Doctor, agree. So if di available, we have to report to DOH so that yun nga.
It doesn't have to be the central office. It has doon lang sa Center for Health Development in that area or region. Or the municipality, no? The municipal health or the city health office, report it because dictate na yan, mandate na yan, in place na yan dapat. No? Availability of diagnostics and treatment should be there.
Okay, Doctor, again, thank you for your shining light on the current situation of PTB in our country and also sharing your time, effort, expertise regarding this disease, which is very timely rin nga, Doctor. It's still a problem in our country and even in worldwide, actually. So thank you again, Doctor. And I'm for the attendees, I hope we can answer that offline through you can
Maybe
contact
that,
us. Yeah.
we can get all the questions and then we'll try
Sige,
to work on
Doctora.
it to be able to answer it. No?
Yes, Doctor. I think
My
we can do that.
pleasure. My pleasure.
Thank you again, Dr. Mateo. So before we end this health forum, we now welcome our last but certainly least speaker, sorry, nabalal ako, to give us a closing message for this health forum. May I welcome our current and incumbent regent for the PCP Northern Luzon region, Dr. Danilo Baldemor, for our closing message.
Maraming salamat po. Magandang umaga po sa ating lahat. So, nagpapasalamat po tayo kay Dr. Aimee Mateo at sa isang buluhang pagtuturo sa atin tungkol sa PTB. So, ang pag-aaral upang malaman ang tamang dahilan ng sakit ay isang paraan para malunasan ng tama ang ating mga nararamdaman. Sa ngalan ng Pangulo ng Philippine College of Physicians, si Dr. Diana Payawal, at bumubuo ng Board of Regents at PCP staff. Kami po dito sa Media Communications Committee on Health Forum ay lubos yung nagpapasalamat sa inyong pagdalo sa araw na ito, lalo na sa ating mga PCP members, media partners at mga pasyente. Manatili po kayong nakasubaybay sa aming Facebook page, sa YouTube at sa mga iba pang social media pages ng PCP para sa mga karagdagang tama at napapanahong kaalaman at impormasyon para sa inyong kalusugan. So magkita po tayo muli sa isang buwan. Thank you po.
Stay safe, everyone.
Okay, thank you, Dr. Valdemar, for your closing message. And again, thank you for all that who have attended this week's PCP Health Forum. Thank you for all the avid viewers who continue to watch and support us through this webinar and through FB Live and our other social media platforms. Of course, we also have a YouTube channel as well pala. So let us remember that TB is a curable and preventable disease. By finding and treating as many Filipinos with TB, we can get back on track to becoming a TB-free Philippines. So for announcements as well, our next PCP Health Forum on September, we will have topics on HIV and leptospirosis. And I would like to also again invite everyone to the 25th Mid-Year PCP Convention entitled Pandemics Aftermath, Facing Diverse Issues on a Renewed Internist Perspectives. This November 18 to 19 of 2022, it will be held in Subic Bay Exhibition and Convention Center. So here in this slide, we have how we can register. So you can either pay through the following, GCash or yung deposit to the Philippine National Bank. And then the account is there. Screenshot your proof of payment and you can scan the QR code for your registration form and fill up your details. Again, thank you all for attending. Thank you, Dr. Mateo, Dr. Baldemar, and Dr. C for this health forum. Keep safe, everyone. Good morning. Yes, good morning.
Bye. Stay safe, everyone.
Bye. Stay safe po.
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, wishes to thank its media partners, social media followers, and participants. See you again next time, here on the PCP Health Forum.